Okay, or
I can hear you good.
okay, awesome. Thanks, Allie. Appreciate the introduction and helping me out again on the call. Um, I want to thank everyone for taking time out of their busy days to attend our virtual Zoom conference today on balance and falls and dizziness. So I just want to briefly talk about myself. Those who don't know me, I am Kevin Flaherty. I own Flaherty Physical Therapy. I am a physical therapist and have been working in physical therapy for 29 years, mostly in practices like my own. I have been really spending a lot more time over the past maybe 5 to 8 years on dealing with people with some vestibular problems and balance and fall issues. So very intriguing problem for me and have found it to be very interesting. So I'm going to start to share my screen with you guys, and we're going to start the presentation. Al, you can see that okay?
Can see it perfect.
Great. So here's our to-do list for today. We'll talk a little bit in a second about some goals and statistics about balance and fall issues. We will talk a little bit about anatomy of the vestibular system. It's important for us to all know that. We're going to talk about posture, and this is where we get a little interactive with our presentation. It's going to have you all kind of try and stand up and do some things. So hopefully you're working on a tablet or a laptop where you can just kind of put it aside and try some things with us today. We'll talk a little bit about some of the things we do in our vestibular program for physical therapy. We'll talk about why do we fall, some home safety advice, and then just talk a little bit more about concussion management. We deal with people that have had concussions, and we will also talk about these top 4 exercises for you to work on balance. You're going to leave here knowing whether or not you're an appropriate person for PT, and we'll talk about, we have a specific balance and fall screen that we use here. All of our PTs are trained in how to do it, and if you're interested, we'll talk about how do you get a free test about your balance. So for me, our goals for today are just to become more educated about balance and dizziness, to recognize that, we hope that you don't have to live with these problems. For those of you that have had any kind of vertigo or room spinning type symptoms, they're dreadful. They're awful symptoms. And my hope is that we can do as many things to help people get out of having those awful sensations. I think it's really important. I want you to learn today about how posture influences your balance. That's really super important, and we talk a lot about that in the clinic. You'll learn some exercises, and then we'll talk about whether or not PT is a good fit for you. So you can see from this slide, there's a lot of information in there about fall statistics. They're generally not very good, though. More than 30% of the U.S. adults 65 or older fall. They're the leading cause of death in this age group. Falls are the most common cause of non-fatal injuries and hospital admissions in people 65 or older. 1.8 million people were treated in hospital ERs for non-fatal falls in 2005. Most commonly are fractures. Fractures in the hip and pelvis and the shoulder are the ones that we generally tend to see the most. And they're expensive. These numbers are from 20 years ago, but direct medical costs were over almost $180 million for fatal falls and $19 billion for non-fatal falls. So we're talking about a big impact on health and safety and on finance too as well. And a lot of reason why we have some fall issues is because our vestibular system just isn't quite working well enough. The vestibular system is a sensory system. It helps us know where our head is positioned in space. That's kind of really what the most important thing for you guys to know about the vestibular system. It also helps us to coordinate motor functions that allow us to keep our balance, stabilize our head, and maintain decent posture when we're standing. The vestibular system has 5 distinct organs to him, and there are 3 canals that are they're sensitive to changes in a straight on motion. And there are 2 other otolith organs that are sensitive to straight line acceleration issues. So here's a picture of the vestibular system. On the left side of your screen is the ear. So that's the external ear. You'll see in the middle there's a canal. There's the tympanic membrane or your eardrum. And then everything to the right of the eardrum is all inner ear stuff. So you'll see one thing looks like a snail, almost a circular snail, and that is the cochlea. And you can see part of that cochlea as it winds up into the straight part of the snail has these canals. Those are those semicircular canals we'll talk about that we do deal a lot with when it comes to vertigo issues. So if we take everything, the outside of the ear away, and we just look at the inside, there's that cochlea again. There are those canals. You can see the yellow is some nerves. We have the vestibular nerve plays a large role in allowing the vestibular system to work properly. So this is the point in the presentation. Those of you that have attended some of my workshops before, you know that we've done them mostly in-house. And so we have people come in, and this is the time when we have people stand up. And so right now, I can't see anyone because I'm looking at the presentation. But if it's safe for you, what I'd love you to do is just to try and take a minute and come stand up. But before we do that, what I want you to do is look at the picture that's in front of you, and you'll see same woman. On the left is her with horrible posture. On the right is her with much better posture. And here's our first 2 exercises that we're going to talk about. So you can see on the left side, her head's forward, shoulders rounded, her abdominals aren't really, they're kind of, they're just not really taut at all. There's an excessive curve in the lower back. Sometimes also there can be some straightening of the knees as well. But when we cue her to pull her shoulder blades back, and we cue her to tuck in her stomach and tighten her stomach, and then tuck in her chin, you can see how much better her posture looks with some gentle cueing. So what I'm going to ask everyone to do is put your laptop or your device down, turn the volume up if you can't hear me okay, and turn it up a little bit. And what I want you to start thinking about is, if you have to, you can go over to your kitchen counter or somewhere you can hold on to something. But I want you to just stand and pull those shoulder blades back and let them really pull back, and you get a sense of how much are your shoulders rounded forward. And this is an excellent exercise that everyone can do every day. Posture is negatively affected by gravity. Our body fights gravity all day long, and usually gravity wins. So we have to fight gravity hard, and one of the first great ways to do that is just by pulling those shoulders back, and then just really pulling those shoulders back and holding it for about a count of 5, and then letting them relax. So take a minute and try to just pull those shoulder blades back. Don't let your shoulders shrug up towards your ears. Try to think of your shoulders coming back around, and just holding that position for 5, and then let it relax. Try a couple of those. Now, also, another great exercise for us to do is just to draw in our stomach. So can we tighten up those stomach muscles, almost like we had to put a really tight pair of pants on? To buckle those pants, we have to really draw in our stomach nice and tight and buckle our pants in the front. So just take a minute, stay standing, draw in your stomach, hold it for a count of 5, and then let it relax. And try a few of those. Draw in that stomach, hold it for a count of 5, and then relax. And then before you sit, I want you to take a minute and let's try, can we pull our shoulder blades back and draw in our stomach at the same time and keep them both nice and taut. So take a minute and just try that. Get those shoulders back, draw in that stomach, keep your shoulders back as your stomach stays nice and tight. So if you were able to stand up, great job. That's awesome. And those are your two exercises. I didn't mention it earlier, but I'll tell you, tomorrow or Monday, based on how busy we are in the office, Allie or one of her associates is going to send you this presentation as well as send you the 4 exercises. So you'll get those by email. Usually by tomorrow, we may also have the link available on our YouTube channel of the presentation. We're recording the presentation today, and so hopefully you can always go back and reference it, or if you have a friend or family member that couldn't make the presentation, you can go and just watch it on YouTube, on our YouTube channel of Flaherty Physical Therapy. So what makes the vestibular system work? So if you haven't sat down, go ahead and get comfortable, sit back down, grab your device, and we'll continue on with the presentation. So the vestibular system works by information being taken in from the eyes, from the inner ear, and then just sensation from the bottoms of your feet. All of that information is taken in by the brain, and the brain helps us determine how do we stand tall and maintain good posturing and balance when we're on our feet. And so dizziness is a common side effect and strongly affects that vestibular system. So we see a lot of clients in our office that have some complaints of dizziness from time to time. And here is just a list of some reasons why someone might have some dizziness. Medication is a big side effect, and not only just one medication, but if you're taking multiple medications, the interactions of those multiple medications can sometimes cause dizziness. Alcohol use is a big one. Blood pressure changes is a big one too. And something called orthostatic hypertension is something we see all the time. Now, what this is if you're laying down or sitting and you go to get up and you get up quickly, sometimes you get a sense of just feeling a little woozy or just a little off. And so basically what happens with that is that quick change of laying down to sitting up or sitting to standing changes your blood pressure. And so your blood pressure changes, it drops quickly, and then you have that sensation of just feeling off. Some past medical history of head trauma can be a cause of dizziness, and some vestibular dysfunction we'll talk about in a minute, and vertigo is another reason why you might be dizzy. So here is just a list of 5 different vestibular problems that we see in the clinic, and these are bad ones. These are problems that you may have heard of or have seen. These ones usually don't always respond well to physical therapy. Usually it needs some medical management for these. So the first one's vestibular neuritis. Remember we talked about that vestibular nerve. So sometimes a virus causes an insult to the vestibular nerve and can cause some vertigo and nausea. That's one of these diagnoses that we can treat. That's something that usually with some repositioning exercises that person could be helped. Labyrinthitis is an infection to the labyrinth, and that, if you remember from the picture, we saw that snail-looking item that was circular. These people usually have some nausea, imbalance, and hearing issues. Meniere's disease, this is still unfortunately a medical mystery. Usually it's diagnosed by 2 or more spontaneous recurring vertigo attacks, and very important, hearing loss is usually seen with this. It is possible to have a neuroma or a tumor on the 8th cranial nerve, and it's called an acoustic neuroma. Usually there is some hearing loss associated with this too. So we'll talk a little bit about hearing loss in a minute. And then obviously having a TIA or a small stroke or a large stroke can cause some issues in the brain, and can also cause some issues in the lower portions of the brainstem and the cerebellum. Those areas have a lot of control over balance, and they can affect that. So if you remember, here's those canals again. And what can happen is, you can see on the left side of the screen, there's it's highlighted as something called otoconia. And otoconia are these small little, very microscopic crystals. And within these canals, there's a viscous fluid that helps to maintain our posture and upright balance. And so sometimes what can happen is one of these otoconia can get kind of stuck in one of these tubes. It's almost like if you think about when I use the analogy a lot, you're out watering the flowers and you have the hose, and all of a sudden you move the hose and you lose the pressure in the hose. There's a kink in the hose somewhere. So you got to put the hose down, walk over, unkink the hose, walk on back and keep watering. Well, very similar, these otoconia can create some problems with the flow of fluid back and forth and restrict that, and then cause some vertigo, room spinning type symptoms. And here's what those otoconia look like. They're really very, very super tiny. The picture on the right is actually a microscopic picture of what the otoconia look like. They play a huge role in creating some vertigo issues, but the nice thing is with true vertigo, we can actually get those otoconia put back to where they came from to stop creating irritation. And so we talked about the otolith before, and these are sensory areas in the inner ear, and you can see the utricle is sensing motion on the horizon. And the saccule is measuring movement and the up and down the vertical plane. And so when we move quickly, either side to side with our head or vertically up or down, the utricle and the saccule are helping us maintain steady balance. When we have trouble in those areas, that's where people feel dizzy or lightheaded or just kind of a sense of feeling off. So one of our tests that we do when we treat someone who's complaining of a lot of dizziness or some positional vertigo is we try this Epley's maneuver. And there's a way that we do this. We have them starting sitting, and then we take them back with their head slightly over the edge of the table, and then we rotate their neck the other way, and then we have them sit back up. And so what we're doing is you can see those canals right next to the patient in the picture. And so as we keep moving them from one posture to another posture to another posture, we're just we're taking the otoconia and allowing it to go recirculate back in where it came from. So one big thing for us when we deal with anyone that has any complaints of dizziness or vertigo is it's important we have to ask a lot of questions to determine which it is. And so this just gives you a sense of some of the words that we hear from our patients when they come in. People will talk about vertigo, but really vertigo is room spinning. So people come in and they may say, yeah, I feel a little woozy. I definitely have some vertigo. And unless they're complaining of the room spinning or they have to hold on like they're on a ship like the Titanic and it's just waves going back and forth and they can't control it, that's vertigo. Dizziness is actually something that's different than that. And it's more kind of feeling like you're lightheaded or feeling like you're kind of hungover or drunk or feeling like you're in the water and you have this off balance sensation or you're floating or feeling a little bit like a whirling sensation. So these two problems are very different in nature, and we do different things to help fix either one of those two problems. So let's just take a few minutes and talk about why do we fall? You know, what are some of the reasons for that? And posture is a big one. Our posture worsens over time. Our head gets forward, our shoulders get weakened, our core muscles get weakened. And between that weakness and lack of core strength, we end up being a little bit more sedentary than we used to or we like to be. And so we sit more. We're not as active. We don't get up and move around as much. And so now we're weaker. Our posture is worse. We're sitting more. We end up getting more fearful of falling. We're worried about what could happen if you get up on your feet. Are you going to slip and fall? Can you maintain your posture? What's going to happen? So think about some of those other things that maybe, if those of you that maybe have already had a fall or two, what are some of those other things that affect you? And we've got to try and work on finding out what they are and just try to stop. So physically, there's a lot that we can do, and number one, we talk a lot about improving posture. And we talk a lot about that in all of our clients, but mostly in our older clients, we try to get them to get their posture, shoulders back, core muscles nice and tight. We encourage activity. We want them moving and being active as much as possible. We want them working on some basic exercises. And so the nice thing is I'm hoping always to see people now, because all it's doing is allowing them to now to have a home exercise program that in New England, when the weather gets bad, what do? We lock ourselves in the house. We never leave, right? Well, now you guys are going to have exercises to work on. I'm going to encourage you to keep working on them. Our patients that come in with some vestibular dysfunction, we do a lot of balance training with them. And so what we find is that the balance gets better because of a lot of different things, because we're training it. The people that have that dizziness and that long-term kind of just feeling off center, I use the analogy a lot, vestibular problems are like a factory. Think of a factory that is making widgets, and the factory has 10 widget lines going all the time, 24/7, because they're very busy. They make all these widgets. And then let's say 2 of those lines goes down. There's a problem, they need to fix them. And when those 2 lines go down, the other 8 are responsible for maintaining the production of that widget making company. So it's just like what happens in a vestibular problem, is our vestibular system just isn't working as efficiently as we want it to. So what we do in our clinic is we do certain things to push the vestibular system to work more effectively and more efficiently. And so we train balance and we get you stronger. We work a lot on posture. When all those 3 things work together, people have less symptoms. So increasing your activity level, improving your posture, increasing your core strength, and working on your balance will definitely lead to less of a fear of falling. So here are some reasons why you might find physical therapy to be helpful. One of them is kind of this sense of the room spinning or moving. You go to get up, or you're laying in bed and you go to turn, you have this sense of whirlingness or spinning type sensation. That's what we call positional vertigo. Lightheadedness and some blurred vision, nausea or vomiting, ringing in the ears, hearing loss. Those are all things that fall into that category of some vestibular dysfunction. And we have some really good success with helping people reduce some of those symptoms. And finally, we always do some work on the neck too, because it's interesting to find that when someone has some posture changes, usually there's some pain in the neck or stiffness in the neck. So we do some work in that area to get the neck more mobile, get it moving better. We address that person's posture and strength. We get them working on balance. They end up feeling better, a lot better quickly. So this is the point in when we do our in-person workshops where we get people standing back up again, and we get them doing some balance exercises. So I thought what I would do is I have an exercise program that we use here, and I'm going to pull that up, and I'll share my screen again. Where is it? Here it is. And so I'm just going to talk, I'm going to let, the nice thing about our program is there's a video component to it. So I'm going to just show you those first 2 exercises that we talked about before. Here's the first one, and we call it scapular retraction, just kind of pulling those shoulder blades back.
Begin sitting in an upright position. Gently squeeze your shoulder blades together. Relax and then repeat. Make sure to maintain good posture during the exercise.
Allie, could you hear that okay?
Perfectly.
Great, awesome. So there's that first one, pulling those shoulder blades back. And here's the other one we talked about, just kind of drawing in that stomach, keeping the stomach nice
Begin
and
lying
tight.
on your back with your knees bent, feet resting on the floor, and your fingers resting on your stomach just above your hip bones. Tighten your abdominals, pulling your navel in toward your spine and up. You should feel your muscles contract under your fingers. Hold this position, then relax and repeat. Make sure to keep your back flat against the floor and do not hold your breath as you tighten your muscles.
So this is one, you can see she's on the floor. So I'm going to give you my, my general thought process on, should I get down on the floor to do some of these exercises? And my answer to that when people ask me that is only if you can safely get up off the floor should you be getting down on the floor to do your exercises. If you're not comfortable getting up from the floor, then you should not be getting down on the floor. You should either be on a couch, on a recliner, or just on your bed. Those are your three best options. You can see that exercise when she's not a lot of things you can see from the video, but when she's drawing in her stomach, she's working on just trying to keep her stomach muscles nice and tight. So that easily can be something done just sitting at the kitchen table or standing at the counter, washing some dishes. Start trying to draw in those stomach muscles and keep them nice and tight. Now, here's just a couple of very basic and simple balance exercises. Now, I think you all can see the video, but what I did was when I send you the handout, you'll see there's some notes. And this is super important down here. So for safety purposes, do it near your kitchen sink. So if you are unstable, you can always hold on to the kitchen sink while you're standing on one foot. And what we do is when we train balance in our clinic, we have people do a few with their eyes open. We have them do a few with their eyes closed. And most people find when their eyes close, they lose that kind of sense of stability, because think of why. Remember, we talked about the vestibular system. Vision is a big part of that. So people that have some vision impairment have to rely on a lot of the other systems, their feet, their ears, to offset the lack of vision. So it's always good to train balance with your eyes closed. But again, we always want to stand near the kitchen sink. And then when you get really good at eyes open and eyes closed, what we have people do is stand near the kitchen sink and we have them turn their head back and forth. So it's always good to kind of take you through that progression. It's only going to show this person standing on the pad. And so you can see right here, he's on this foam pad. And so, you know, if you don't have a fancy foam pad, find an old lousy pillow that you don't mind standing on, and standing on that pillow will make your surface just more unstable.
Begin in a standing upright position on a foam surface with your arms resting at your sides. Raise both arms and lift one foot off the surface by bending your knee, transferring your weight to the other leg. Hold this position. Make sure to keep your back straight during the exercise. Do not lose your balance and do not let your legs touch while you are balancing.
So you can see he's obviously younger, very steady on his feet. Some of you listening may not be quite as steady. So that's okay. Just make sure you're near the counter so that way you can keep yourself under good control and good support. Here's another balance exercise that we do, and it's just standing in tandem stance. Tandem stance just means standing within your feet in a heel-toe position.
Begin in a standing upright position with your arms resting at your sides. Place one foot directly in front of the other, so you are standing in a heel-to-toe position. Maintain your balance in the stance. Try not to move your arms away from your body and make sure to keep your back straight.
So again, young person, balance is very strong and stable, right? Some of you, maybe not so much. So this is another great one we're going to try and do standing at the kitchen counter. You could stand alongside the counter. You can hold on with both hands if you feel like you have to hold on with both hands. And then finally, we just encourage some tandem walking. And that's just, again,
Begin
at the count.
standing in a long, open, flat space. Walk forward, placing the heel of your foot directly in front of the toes of your other foot. Make sure to keep your movements controlled and maintain your balance during the exercise.
And then while we have people do forward tandem walking, we also have them do some backward tandem walking.
Begin standing in a long, flat, open area. Walk backward, placing the toes of one foot directly behind the heel of your other foot. Continue this toe-to-heel pattern as you walk backward. Make sure to keep your back straight as you walk backward.
All right, so now, we considered forward and backward tandem walking one exercise. So we've got our 4 exercises that we're leaving with today are pulling the shoulders back, tucking in the stomach nice and tight, standing balance with your eyes open or closed or with your head turning, and then some tandem standing and walking. So think about those 4 things. And again, you know, you're all on this call because you probably are concerned about your balance, or you maybe have some fear of balance. So please do me a favor, and when you decide to try some of these, that you make sure you're at the kitchen sink. Keep yourself nice and strong and stable and protected by, you can see those people in the videos who are younger, they're able to do it quite easily. What we want to make sure is that while you're doing it, that you stay as safe as you can. All right, so that's our balance demo when we do not have people in the clinic. So, here we go. So I want to just talk briefly about home safety. Making sure the walkway is clear in your house of any clutter is super important. It's easy to try and it's not easy to try and step over items, you know, that are on the floor or in the way that can lead to a risk of falling. Make sure the path from your bedroom to the bathroom is well lit. And this way you can see, especially if you have to go to the bathroom at night. Having handrails installed in your home is very important. And it can just make your life easier by just grabbing the handrail at the toilet and in the shower. Use the banisters for the stairs. You know, when we're younger, we just fly up and down the stairs. As we get older, we have to make sure that we're using that banister. We want to avoid furniture walking, which just kind of means, you know, you kind of hold onto this and you hold the wall and then you hold the chair and then you hold the countertop. You know, sometimes using a cane can be really important. And then finally, we're going to put some, you know, non-slip padding near on the floor, so that way you're not going to slip on a throw rug. You can see that rug that the person standing on is very thick. Easy way for someone to get their foot caught on there and a bad thing to do. Now, this is the point in time where I talk about canes and walkers. And I know, and I don't know because I'm not that age. I'm only 52. But I know because I've dealt with many clients over the age of 65 through my 29 years of doing this. Not one of them was very excited about using a cane or a walker. Because there's just kind of the stigma of, oh, you know, now I'm this elderly, frail person and I can't, you know, I've got to use those canes and walkers. But I'll tell you, I think it's one of the best things you can do if you're feeling unsteady, because it just allows you to stay active and it also allows you to stay safe. So I really want you to consider trying to use that cane, try to use that walker if you feel like you need to, so you can stay safe and you can stay active and stay busy. Now, we talked about some of the reasons why someone might fall, but a huge part of falling is just being anxious about falling, being fearful of falling. And so we like to teach people how to breathe through the diaphragm and breathe by working on trying to focus on being mindful about their breathing. When we're anxious, we don't know what to do. We can't get out of our own way sometimes. And breathing is a nice way for us to work on just calming ourselves down and just allowing ourselves to just be a little bit quiet and a little bit more relaxed. So and this we'll throw this handout with you guys too as well. You'll get this one as well tomorrow. But if you sit in the chair and you just focus on having one hand on your chest and one hand on your abdomen, and you could all do this right now. Everyone take a hand, put it up on your chest, take another hand and put it right on your abdomen or your belly area. And just take some breaths, regular breaths, in through your nose, out through your mouth, whatever works for you. And what you'll probably see is a lot of the breathing comes from the chest. And when we breathe a lot from the chest, what happens is we get tightness through the front of the neck, into the front of the chest. And then with that, what happens is we end up having some more tightness in through the neck or some more restriction through our neck. And breathing is a nice way for us to relax that. So as you're sitting there paying attention to your breathing, can you focus on trying to make sure that your breathing comes from the abdomen? So as you breathe in through your nose, I want you to try and see, can you push your abdomen out? And when you breathe in, push your abdomen out. And then when you breathe out, just let your abdomen fall. So it's breathe in, abdomen rises, breathe out, abdomen falls. And sometimes it takes you a little bit of some time to figure out that pattern. It's not always easy to figure out that pattern. And so be patient with this, but just some regular mindful breathing can be very, very helpful in allowing us to be a little bit more calmer and a little bit more relaxed and less anxious. And anxiousness is really a big factor when it comes to being unstable. So we want to try to avoid that as much as we can. I'm just going to talk briefly about concussion management because part of our vestibular program is actually dealing with people that have had concussions. And so, the definition of a concussion is it's an injury to the brain, results in some temporary loss of normal brain function. And it's usually a blow to the head. And in many cases, there may be no sign of any external trauma. But the fact that there's that kind of what they call counter coup, or the head coming forward and backward in a whiplash fashion, and can cause sometimes this concussion issue. Sometimes people think it's only when you lose consciousness, but it's really not true. Many people have concussions and never lose consciousness, so that's not always a driver of whether or not you have a concussion or not. So we obviously see them in sports players, motor vehicle accident patients, or people that have had recent falls and have had some blow to the head. And so you can see from the picture, the brain is in, the skull, but, from the trauma of the fall, there's this kind of forward motion of the brain and backward motion of the brain. So it's very traumatic to the brain, but the good news is we can do some treatment and help people with this. So the way we treat, we do a lot of work on mindful breathing, like we just talked about. We get people started with some aerobic exercises. We work on their neck. We work on their exercise strength in their body. We do some balance work, and then we do some kind of slow and steady return to sports or activities that they like to do based on how they're feeling. So, this is the point in the presentation for me that's the most important. And, we all have issues that we have to deal with. There's generally three things we're going to do about it. We're either going to ignore it, we're going to try to alter or change it, or we go all the way in and we decide we're going to handle it. And I'm going to give you a story. If you've heard this story before, I apologize, but it's a perfect way to describe this whole thing of handling it. I have a colleague who has a physical therapy company in Pennsylvania. He's very successful. And one of his offices is in a strip mall. And so there's 4 suites in the strip mall. And, you know, he had this one ceiling tile in his office and it kept getting stained from water. And so he was like looking at it like, I don't know what that is. I don't know. I'm too busy. I'm just going to ignore it. And then he started to have some of his patients would say, hey, I don't know if you noticed that there's a big leak, you know, wet spot on your ceiling tile. I don't know if you should probably get that checked out. And he's like, yeah, I'll get it checked out. And so then he was like, you know what, maybe I'll try to alter or change something with that. And so he called his roofing guy and called the roofing guy up and said, hey, listen, you see the leak in the ceiling tile, what do I do? And so the guy goes up on the roof and he goes, you know what, it's not a roof problem. It's your HVAC problem. You got to call that guy. He'll come and take care of it for you. So he's like, okay, great. Well, so he calls the HVAC guy in perfect homeowner fashion. The HVAC guy says, nope, it's not me. It's the roof guy. You got to call back the roof guy. So now my friend is like, I don't know what I'm going to do. What do I do now? I have no idea. So he ends up having a client in his office, and the client says, he says, oh, you fix roofs. Can you take a look at this and tell me what you think? And so the guy goes, I'll take a look. And so he went up and he's looking in the crawl space in the attic and he goes, you know what, your problem's not with your suite. It's actually 3 suites down. I can see where the water's coming in down the side. It's running down a truss in the ceiling. It's ending up on your ceiling tile. So I'm going to fix that spot 3 suites down. It's going to fix the problem. So we finally found someone that could help him handle the problem. And that's, to me, is the most important thing. We have to make a decision on how we're going to take care of this and how can we handle the problem. And so if you've been living with dizziness issues or fear of falling, it's just a dreadful feeling. And I feel really bad for you. So I want you to try and really think about what are some of the things that we can do to try and help you handle this problem. I'm giving you 4 exercises. Those are things you can easily start later today. Start working on them right at your kitchen sink, and that's a great way to start. But sometimes you might feel like you may need a little bit more help. And so, you're talking to your doctor and you say, hey, doc, I'm feeling dizzy. Well, what is your doctor going to do? So they'll do their clinical examination. I hope that they will talk to you about medications because I think it's very important. Sometimes specific medications interact with each other and they can cause a lot of dizziness issues. So have the conversation with your physician, especially if there's issues related to one medication interacting with another. They may do some testing, may do some hearing tests or an MRI of the brain or some specific vestibular testing that might be done through an ear, nose, and throat. But a lot of times your doctor will just send you right to us and we're going to do our full evaluation. We're going to determine, is this a posture issue? Can we retrain the posture? Or is this an issue with strength? Should we do some exercises for strengthening? Or do we need to do some work on the vestibular system? And then we figure out what it is and we work on trying to take care of it. So like I mentioned, we do our assessment first, figure out why you in the clinic, what do we need to fix? And then we focus on, like we just said, posture, strength, endurance, and then balance. Now, everyone that's on the call, we're offering to all you on the call a free balance and fall screen. It's very simple to do. It takes about 30 minutes. What we ask you to do is if you're interested that you call our office, and there's our number, 508-393-9000. Speak to one of my office people. Maybe it might be Allie, it might be someone else, and tell them you attended the workshop and you wanted to get booked for a balance and fall screen. What we do is we do 3 tests. You hand answer on a piece of paper some questions, and then we take you to 2 balance and endurance tests, and we come up with a risk factor. Are you a low risk for falling? Are you a medium risk or a high risk of falling? if you're just a low risk of falling, generally what we'll do is we have a set home program. We say, you know what, take these exercises, go work on them at home. More often than not, what we generally find is that people can probably benefit from some physical therapy. So we say, you know what, let's come in and do an evaluation, and let's start you into some therapy where you'll have some home exercises, but between some clinic treatments and some home treatments, we think that will work the best. Or sometimes in a really small amount of the cases, we just think you need some more medical help. So we'll send you back to the doctor. So that's why we ask for your doctor's information. So that way we can send them our report, which either gives them all the information of how you did with all the tests. Or you might just be interested in physical therapy evaluation. And if you are, again, you'd call the office again, tell them you attended the Balance and Fall workshop, and you'd like to set up an evaluation to come back in. We have people, and Allie is the one who does it, where she goes and she'll verify your insurance, help you understand what your coverage is for physical therapy. And then we do a full 1 hour comprehensive eval where we ask you a lot of medical questions. We do a lot of functional movements. We look at range of motion, strength, balance. We look at quite a few things. We have 4 physical therapists that have some training in vestibular management. So we'll try to get you in to see one of those therapists. And then you'll leave that first day with a plan to start doing some home exercises, as well as some visits for you to come back. So that's pretty much all I have to talk about today. I think Allie had mentioned, if you had some further questions, to put them in the chat box. Allie, are there any, I can't see it because I have my screen is still up. Are there any questions at all in the chat box?
There is nothing in the chat box right now, no.
Okay. Does anyone have any questions that they would like to pose? If you do, just raise your hand and Allie will unmute you, and then you can ask your question, and then we'll give you an answer, hopefully.
Nobody? Who's raising their hand for us, Kevin? Oh, I think Judy might have a question. Hold on. Let's see. Judy, Kevin, I asked her to unmute. Is there anything else that I can do? Oh, there she is. Hi, Judy.
Hi.
Go ahead and ask
Hi.
a question.
Okay. So I'm in already doing exercises with Michelle,
Yes.
and some of these I've been doing in the past, with the little squishy foam thing and the balancing.
Yes.
So do you think I should double up on that stuff to do some of these things at home more, or right now I think I'm doing them twice a week as it is. And I don't have any dizziness, but I do have balance problems with my feet being not quite as they should be.
Yeah.
So what's your thought on that? I can't really overdo it, can I, on the foot, on the tandem?
No, you really can't. You can't overdo it, Judy. And what I would say would be, first of all, you just always want to stay safe. So that's really very important that you're doing this in a comfortable area in your home where you can stand with some support. But trying some of them with your eyes closed, this tandem standing or the tandem walking, when you do it with your eyes open, it's hard. But when you do it with your eyes closed, it's harder. So you could try doing some with your eyes closed, but always being near the kitchen sink so you could hold on to it if you needed to.
Well, I have this neat galley kitchen, so
Okay.
it's neat because I can grab either side.
Perfect. Yeah. Yep. That's great. And the other thing too is just that head turning movement is one that throws your balance off. So you standing at the kitchen counter and just holding on and just trying to keep your eyes open, but turning your head side to side, many times can actually, again, it's harder to do, but will work the vestibular system just as well. So when you're in, talk to Michelle, and you know, mention to her, you heard the workshop, you sat in on it, and you're looking for some things more, you know, some more advanced balance exercises. And I'm sure she would be able to give you 2 or 3 ones to try at home.
Okay, great, great.
Great question. Thank you, Judy.
Yeah.
Anyone else with another question?
I'm not seeing anybody. Let me check the chat again. Oh. There's nothing in the chat that I can see.
All right. Well, so like I said, I want to thank everyone for coming today. I will, Allie's going to help me tomorrow, just get the presentation out to you guys with the exercises and the breathing handout that we have. And then we will also have a link for the presentation from today that will be on our YouTube channel. So look for that within, if it's not tomorrow, it'll be there on Monday. And hope you guys have a great few days, and hope to chat with you soon. So have a great day. Thanks for coming.
Bye, guys. Thank you.